welcome to Healing Stories from Around the World. Join with us as we go across the globe, spanning the continents, bringing stories of hope and healing. From America to Europe, stories of God's intervention in the lives of individuals that brought them hope. From Europe to Australia, stories of programs impacting individuals in their communities and in their churches and homes. You know, it has been said, God opens doors for us. We must enter. Then allow ourselves to be used to open doors for others. God opens doors for us. We must enter, then allow ourselves to be used to open doors for others. Now, the first individual in our interview this evening did just that. I'm going to invite to the podium Stoy Proctor in a moment. We'll hear stories of how he had his healing, but also what he has done for others. Then we will go to the Australia and hear about those programs impacting lives. But before we begin, we want to talk to the Lord, the healer of us all. And so I invite you, if you're watching at home, television audience or online, to just pause with us as we recognize the God of heaven. Father and our God, we thank you for life. We thank you for giving us hope. And now, dear Lord, healer of hearts, restorer of minds, may we see you in your beautiful picture of who you are, the God of restoration, as we hear of the lives you've touched in the next 20 minutes. We give you thanks and we give you praise. Amen. Now, our first interview, we have Stoy Proctor, a retired health ministries director from the General Conference. And as I mentioned about opening doors for others, I met Stoy a little while ago, and Stoy was at the conference in Geneva. And there was a young lady who wanted to do some health ministry, and she had some books, and she didn't know where to go with them. We invited her to meet Stoy. She is a nutritionist, and she's very good in the kitchen, great culinary skills. And she said, what can I do with these books? I said, well, let's have a look at what Stoy will say. He's from the General Conference. She was very timid. I said, let's talk to him. And Stoy came along and looked at her books and looked at the nutritive value of it and what she was saying, and he endorsed her books. And today she's here with a stall, and she started a business just because you opened the door and you affirmed her ministry. And so I thank you for opening the door for others so that they could be blessed. I'll invite now Dr. Alan Handisides to tell us a little bit about your healing story.
I'm so glad that you're here to hear Stoy's story. And I'm going to tell you a little bit of an introduction of the story. About 8.5 years ago, Leilani fell ill. They didn't know quite what she was sick with. She was put on a variety of medications, and she seemed to be improving. A few months later, she noticed that she had a nodule above the left clavicle. Those of you who are physicians would have called that something perhaps like a Virchow's node or something like that. But when it was biopsied and removed, it was found to be cancerous. The mere fact that you would find an ovarian cancer or peritoneal cell cancer manifesting as a lump above the clavicle means that it was stage 4. Stage 4 cancer has a survival rate, ovarian or peritoneal cell cancer has a survival rate, 5-year survival rate, of just about 16% or less. Leilani and Stoy have been lifelong health ministry people. Stoy was probably doing health ministry about the same time as I was graduating from medicine. And that's 50 years ago. It's a long time. We're old timers, okay? And so I would like to ask you, Stoy, about this journey. Because Leilani did not die in the 5 years. She was in the 16%. But unfortunately, the disease has a way of claiming its own. And Leilani was in church. Janet and I sit in the same pew. I looked down, I saw Leilani, waved to her. She looked terrific. Within 5 weeks, she was dead. It was a rough journey for you, Stoy.
You're right.
Could you look back at that story and perhaps tell us, how did you react to Leilani's death?
Unbelief. Ever since we were married, which was over 48 years before that, we have been health reformers. We've followed the principles of health, and especially Leilani. She would not eat between meals. She would not take a dessert, maybe 1 or 2 a year. She followed the health principles. And we were taught at the School of Health, if you follow my way, Exodus 15, none of these diseases will fall upon you. And we believed that. But what we didn't know of, these diseases were not heart disease and cancer. They were skin diseases and digestive diseases of Egypt. We were a little misled, and we were certainly disappointed. And so we had totally unbelief.
You have followed an extremely careful diet. You know, all of us have our own beliefs as to diet, as to how strict we need to be. I am perhaps of the belief that the differences between the pesco-vegetarian, the lacto-vegetarian, and the vegan diet are actually not statistically significant. The difference between a vegetarian diet and a flesh-containing diet is absolutely rock hard, statistically different. And as I travel around the world and see the different opportunities people have to live different kind of lifestyles, I'm not willing to subject an African population to a very rigid lifestyle. But Stoy, you've lived all kinds of lifestyles, but I must say you've lived them to the full. Would you tell us a little bit about your lifestyle?
Be a little more specific. What do you mean?
Well,
what we ate?
did you ever eat meat?
Well, as a young kid, my parents ate meat, and up until I was 14, I ate a little meat. I never liked meat. My brother and I refused it whenever we could, so basically, been a vegetarian for a long time.
And Leilani?
She was a vegetarian. She wanted to be a vegetarian during the time she was with her parents, but they were meat eaters, clean meat eaters. But she said, when I get married, I want to be a vegetarian. So for 48 plus years, she was a vegetarian, and a strict vegetarian. Only once did she try meat, and that was because she was pressured into it, but she only ate a little and was very disappointed at the taste of it.
So do you think that meat that she ate one time caused this cancer?
I don't think so, and I don't think if you'd ate meat several times, it would have caused cancer.
Leilani didn't want people to know that she was ill. Why?
I think the reason she didn't want people to know is because she didn't want to be known as Leilani has the Mr. Big, Mrs. C, the Big C. Because when people know you've got cancer, they always wondered, how are you doing? How are you doing? How long are you? They really are wondering, how long are you going to live? Because cancer is terminal in most cases. So she didn't want to be that part of a conversation. She wanted people to recognize her and to meet her and to know her as just Leilani Proctor. That was enough.
Did she make any changes to her lifestyle after the diagnosis?
Physically, no, except I think she did her research well. She was a good researcher. She as encouraged by her oncologist, she found if there was any late treatment on cancer, she followed the oncologist recommendations by taking chemotherapy. And of course, we were told that, as Alan has said, when she was diagnosed, well, go to Florida, enjoy your condo, get your house in order. In other words, you've got basically a year to live. And that kind of diagnosis is very hard to overcome, a terminal diagnosis.
How did you cope? How did you find strength to cope when somebody's telling you your wife's got less than a year to live?
We coped because we had hope. Our favorite scripture was Romans 15:13, because we served the God of hope. And that is probably the most important thing, and the last thing that all of us have is hope. When our faith disappoints us, when our belief is maybe questioned, we still have and should have hope. So never take away anybody's hope. We had hope that there would be a new treatment around the corner. There would be a new medication. God would decide to heal her. And for 8 years, it appeared so. In fact, after she was passed, her oncologist called and says, I can't believe it. I thought for sure she would make it. We were thinking of writing her up in the medical journals as something that beat the odds. So we always had hope that something better would happen. And whether that hope ends in remission or permanent cure, that's neither here nor there, really. Hope is important to have regardless. You need that hope to survive. And she had that hope. In fact, the day before she died, she was in a coma the last week of her life. But she propped herself up on her elbows. And just as she wasn't talking coherently, but that one time, she propped herself up on her elbows and says, Stoy, I am going to live, am I not? And I says, as God declares, you will live. You will live. One thing that was most important, she also said, Stoy, I love you, I love you, I love you. And then she laid back down, and that was the last she said.
He's doing very well. You're doing better than me, Stoy.
Well,
Some of us, as believers in the Adventist health message, and of course you represent possibly 0.5% of the members in this area that would come to health meetings. We feel that our lives are going to be different from the rest of the church members because we are living this health message. And time after time, people who have been so vigilant, just like Leilani, come down with a cancer. Did Leilani ever ask the question, when I've lived such a careful life, why me?
I never heard her ask that question. Why me? It's interesting because in a condition like this, we were very close for 48 years. In fact, when we got married, and since we got married, there was nothing new about that we didn't know about each other. We all discussed that before we were married. So we were very close. But I never heard her bring up that topic, why me? She knew she had it. She was a rational human being. She understood what cancer meant, but she still hung on to that hope that she would have a better life.
I want to ask you a question that you don't have to answer. But if you'd like to, be good. Did you ever feel, having been a director of the General Conference Health Ministries Department, that maybe you were a little ashamed that you'd come down with, Leilani would come down with cancer?
I think the thought crossed my mind, but I do a lot of research. I know that cancer has multiple causes. I was very confident that Leilani lived a lifestyle, that if there was any lifestyle that prevented cancer, she lived that lifestyle. So we felt no guilt in that way.
And I know their lifestyle. You couldn't have had a better lifestyle. But I want to ask you a question. Do any of you, in your mind, as you listen to Stoy and Leilani's story, have a question that maybe they should have done something differently? I just want you to think about that and answer it in your own mind. Because sometimes I say to people, did I tell you that I was HIV positive? And I know that they're thinking, how did he get the infection?
Yeah.
Of course, I only asked the question, did I tell you? I didn't say that I did or was HIV positive. Stoy, I want to thank you.
May I read?
Yes.
You asked how we coped earlier. She coped with her belief in Christ, and she wrote a poem that I'd like to read. She never wrote a poem before or afterwards, but here's the poem that she wrote. Christ's robe for mine. My filthy rags of sin brought condemnation down on him. For to save me, he paid a staggering price, his sinless life's sufficient sacrifice. Christ's death for mine, his freely given offer has freed me from guilt and suffering. For he was pierced for my transgressions, and he was crucified for my iniquities. Christ's life for mine, I have no need to fear, as final judgment draws so very near. I'm safe in Christ, since in my place he died. My life is justified. My life is judged. His life is judged, and I'm justified. Christ's mine for mine. My spirit is filled with my body, mind, and soul. He fully heals to make me whole. I'm saved by grace and moved at the cost. Without his cross, I would be lost. Redeemed by love, and life is not my own. I'm saved by the love of Jesus Christ alone. I will not seek to know when I must go, but when it comes, I will know.
Thank you, Stoy. Thank you very much.
Thank you so much for that really reflective testimony. And you know, sometimes in life we have no answers for the challenges. The why of life's challenges pales into insignificant to the fact that God is there with us, and that's what gives us hope. Thank you so much. I wonder whether you've ever asked yourself the question, why am I here? What is my purpose in life? What do I have to contribute? And you know, someone has said that our purpose is this: to be acceptable to God and beneficial to humanity. And I want to introduce to you someone who has found his purpose in life, who has been beneficial to humanity through the work that he does. And I'd like to invite to the podium now the next interviewee, and that is Luis Saboga Nunez, who is the health sociologist and professor at the National School of Public Health, and he's going to be interviewed by Viriata Ferreira. Please come and share your testimony of healing with us.
Thank you very much, Sharon. You've introduced my good friend, Dr. Nunes. We happen to speak the same language, and we're going to conduct an interview in Portuguese, so get your translator set. No, we'll not impose that on you. Now, Dr. Nunes is smoking a big health problem?
Yeah, it is. 6 million people die every year because of the use of tobacco.
6 million.
6 million in the world.
In the world, 6 million. And those are direct deaths due to tobacco?
Due to tobacco, according to the organization.
What about all the other diseases that may be somehow related to tobacco?
There are consequences, but it's quite impossible to make an exact figure how much tobacco is influencing other diseases.
Now, do you have any idea? No, we've got a big audience here, and we've got a much bigger audience at home. How many of you know of people who want to quit smoking? Okay? It's many hands up, okay? All right, how many smokers do you think there are in Europe?
According to the Eurobarometer, it's a statistical bureau of statistics of Europe, 70% of the Europeans would like to stop smoking. 75% of the Portuguese would like to stop smoking.
70% of people who smoke would like to stop smoking.
Yeah.
Okay, is it easy to stop smoking?
No, it's very difficult to stop smoking, as it is to change any behavior.
Why is that so?
There are several reasons, but basically because smoking is a social act. Secondly, you never start smoking because you are dependent on nicotine. So in order to stop smoke, you have to enact a completely new change and set of changes in all of your life aspects that will affect forever the way you see life and how life is for you perceived. So it's like a new birth.
Oh, okay, I've just lost my computer. And now I'll have to get another one. And it comes with an operating system and it comes empty. Okay, so does it mean that the operating system of a smoker needs to change?
Completely. Let me give you an example. When you smoke a cigarette, your operating system registers that it needs 14 calories to fight the results of that cigarette in your body. Like, for instance, your nose warms up and your body has to fight this with energy in order to decrease the temperature of your nose. And a team of researchers in Switzerland, they calculated that this is about 14 calories for every cigarette. So if you smoke 20 cigarettes, you can multiply this for 14, and you will see how much your body needs as energy just to fight the fact that you are smoking. Now, when this goes over several years, your metabolism adjusts to this need of energy. So when you stop smoking, your body continues functioning as if it needs the same amount of energy to fight down the results of your smoking act. So at this moment, your body needs to readjust again to the fact that you are not smoking. And this takes about 2 years to be done.
That's amazing. That's amazing. Now, why do people want to stop smoking?
Well, I think there are several reasons, but of course there is a new awareness that is being created by public agencies, governments, but of course there is also an increase of health literacy, and people are becoming aware of the benefits of stop smoking. If you take some issues that are very particular with smoking, you see that the world started to smoke with the Great Wars. Mm-hmm. And some countries started to have smokers after their colonial wars. Until then, it was very seldom to find smokers. So we could say that the fact that for now 50 years Europe has been living in peace and we don't have a world war going on, somehow this has been helping and, to create an awareness that maybe you don't need so much the nicotine to overcome certain situations, like, for instance, facing death in front of you in a situation of war. So people are aware of the benefits. They want to do it, but they are hooked on nicotine.
They're hooked on nicotine and something else, not just on the nicotine.
Yes.
Now, I can imagine a father of 2 small children wanting to quit smoking, looking at these children and feeling, and I know this is, I see patients and they tell me these stories. And he says, "Doctor, I cannot stop smoking. I am in so much pain, emotional pain, because I look at my children and I want to be there for them, but I just cannot stop smoking." What help is out there for people who wish to stop smoking? We've had a tremendous history in 5-day stop smoking programs for many years. These were very popular, and probably many people here have had experience with that. But what can somebody who wants to quit smoking, who is anguishing to stop smoking, what can he do?
You know, I think that is the real issue today. If you want to stop smoke in Europe, you will find 2 types of interventions: non-pharmacological interventions and interventions based on medical products. These medications are quite expensive. Mm-hmm. So if people want to rely on medications, they have to be quite well off to use them. Now, if you go to the non-pharmacological approaches, one of which is most common used is hypnotherapy in Europe, and acupuncture in your ear. So there is not even one scientific article that tells you that this is effective. And that's what people can get. Now, in countries like Portugal, if they want to have help from a health professional, and if they apply to a smoking cessation program in the national health system, in an hospital or a clinic or health center, they have to wait 132 days as a mean to get the first consultation. The best hospital offering the best service in smoking cessation in this country has a waiting list of 2 years. So imagine you are a pregnant woman, you want to stop smoke before your baby is born. Maybe by the 2nd or 3rd baby, you will get the first support to do it.
So you should actually give your name 2 years before you want to fall pregnant. So
something like that.
Yes, it will help. Okay. Now, 5-day stop smoking programs, breathe-free programs, like we have here somebody who's who has dedicated his life to the breathe-free program, and who's just been interviewed here, Elder Stoy Proctor. And we have so much to thank these people for what they've done. So much. Thank you, Stoy. And thank you to all of those who have done these things. Now, but those programs have slowly faded away. And now, you told us that there has never been such a demand for these programs. And what is the offer? What are we offering? Now, you and your son, a few years ago, your son is a dear friend. He was a university student. He was studying space engineering or something like that. Very complex, and working with mathematics and a very complex algorithm. One day you told me that you were just talking about this as well. Why can't we apply these to a computer model to help people stop smoking? And you've developed then with your son that first program, which was stop.net, wasn't in Portuguese, parar.net, which when the laws came to Europe to ban smoking in public places, that whole platform collapsed. Because you could only go to 500, and suddenly you had thousands of people wanting that. Now, you've developed that program to help people stop smoking, where you actually can link these people with health professionals and other people in the community, but it's online, it's interactive, and it's online.
Yeah.
Tell us just a little bit about that program.
Yeah. What is very interesting in this story is that, you know, it's very hard to communicate between sciences. So when you are in medicine and you want to communicate with technology, you have to use the same language, otherwise communication will not.
I know that. I don't use that language.
So fortunately, with Miguel, we had been used to communicate before. And we often work together to discuss other things. And when that night he told me about he was very excited about the things he was discovering in his training, and when I asked him, but if you apply that to a health issue, you think it can work? And he just said, yeah, if you give me the algorithms, it can work. And I asked him, what's an algorithm? So we went through, he explained it to me, and I said, yeah, maybe we can develop the algorithms for this kind of approach. Would you like to help me? And he said, yeah, Papa, if you give me the algorithms, I can try. So it took me 3 years to go through that, plus 2 years to find the substance of the program, and then 1 year for Miguel to develop the program.
Wow, that's amazing. That's a big investment of time.
And by the way, he got so excited about that he failed that year. We could work all the night through. We would come from classes. He was so excited. Hey, now I discovered this. We could do this and that. We just went through.
Well, by the way, he's graduated and he's working in
Hawaii
in a big project with space. So after serving this humanitarian purpose, now he's progressed with these studies. Now, people go online. They register. They are smokers. They register and they start following the program, which is tailored for them.
Absolutely.
And therefore that's complication of algorithms. They follow that, they can interact. This program can actually refer them to their health practitioner, to their medical doctor, and get further help there. So they go there, and how many people, and this is a very important question, how many people actually stop smoking after a year?
Okay, so I can't answer you. The question, because we have had, without any publicity, 12,000 users of this platform.
12,000 users, okay.
And we have not been able to screen all the 12,000 users.
Yes.
So we have to do a scientific research and took a cohort of this group. And from 1,200 that we followed through during 1 year, 32.9% had stopped completely and had not smoked one cigarette during 1 year, 12 months.
That's excellent.
That's the most conservative approach you can have to smoking.
That is excellent. So let's imagine that you extrapolate these to the 12,000. You've got a pretty good sample in 1,200, which is basically 10% of that, okay? Let's extrapolate. Of the 12,000, you have over 4,000 people who have stopped smoking at least for a year. And it would be nice to do a follow-up on those and see, and see what's happening. And that is incredible. You know, the families that you've touched through that ministry, the children that will probably continue to have their parents for longer in this world, this is very meaningful. See, we're not doing this just for the sake of doing a nice project. We're doing it because it's impacting lives. Tell us just one story of somebody.
Yeah, I can tell you a story, but before the story, let me tell you. When we were developing the platform, this was done online, and no publicity was done, so nobody should know about it.
Yes.
Then one day I came home and I asked Miguel, have you been testing the platform because we have some new data in the database? And he said, no, I haven't done anything since yesterday. I said, what a strange thing. Didn't you put this phone number here? No, I didn't. So I pick up the phone and I connected to that phone number and I said, hello. And the lady said, yes. I'm speaking to you because it seems that you are interested in stop smoking and you have registered for a platform to do it. Oh, yes, I did it. Oh, so you are doing it for real? Oh, yes, I'm doing it. And I want to continue with it. Can you help me to pass to step number 2? And I said, okay, I will try to manage it. Sorry if things doesn't work perfectly. If there is any problem, can you send me a message? Suddenly, we had dozens, hundreds of people using a beta program. And then, according to the good practice, when you develop a beta program, you should stop it, make the corrections you need, and then allow it to be used again. We couldn't do that.
You couldn't do it because people were using
There
it.
were no alternative.
That's amazing.
So we inform people that this was not a perfect thing. Problems would occur. Be patient. We are working on that.
So you actually started before you realized.
Yeah.
That's amazing.
We tried to understand how that could be possible, and we forgot Google.
Well,
Google
yes.
is there.
Well, Google is there. So,
So one story.
yes, one story.
One man that started to smoke when he went to the war in Africa.
Yes.
In his 20s, unemployed, suffering from DPOC, OCPD, pulmonary obstructive
Chronic obstructive pulmonary disease.
Thank you.
COPD.
COPD. He used the program because his otorino doctor referred him to the platform in the main hospital of Egas Muniz.
Yes.
And so he followed the program, and 1 year after, he gave his testimony to the doctor and said to the doctor, yeah, you told me that you didn't have the time to help me to stop smoke, but you just gave me the address. And after 12 months, I'm free of it.
That's beautiful.
So what I want to say is this man struggled for more than 30 years to stop smoke. But health professionals, they are very few. And to help a person to stop smoke sometimes takes some time. And this doctor couldn't do it.
Yes.
So she just referred, and this man got free of smoking.
If you want to see this program, you go. We've asked the producers to put a website on the screen. You'll have to take a course in Portuguese. It's now being used by thousands of people. We are thinking of expanding these to other languages, and we hope it's going to be done soon. And it's going to be one more tool. It's not the solution. There will be one more tool in the variety of solutions that will be out there to come and help people who want to stop smoking. I just wanted to say that it is really a blessing for us to work in a church that is investing heavily on these. I know that there's a lot of investment even from the General Conference on developing a newer version of something that was very popular in the past, the Breathe Free. So this is an amazing tool that could help people stop smoking. Dr. Nunes, Luis, thank you very much for being with us.
Can I just add one detail?
Yes.
The program is free.
Oh yes, the program is free. That's very good news.
Thank you so much. There's so much to share. We want to thank you again, Dr. Sabango Nunes, for the impactful work that you're doing there. You know, occasionally with our health programs, we need to pause to assess the efficacy of what we're doing and to evaluate the program's longevity and its sustainability. And as I was thinking about programs and its impact, I came across this little saying that I found not so long ago, and it says this: "Blessed is the man who knows which direction the Lord is moving and gets moving in that direction." And you know, occasionally our programs have to change direction to ensure that a good program becomes even better. And I want to introduce to you now another effective program that had to change direction in order to expand its scope of influence. And I want to just introduce the CHIP program, and we have Kathy MacDonald, who's going to share with us her experiences of CHIP. And Kathy is the General Manager for Sanitarium, the Health and Wellbeing Services, and she's going to give us the overview of the impactfulness of the CHIP program.
Thank you, Sharon. For I have come that you might have life and that you might have it to the full. This beautiful promise in John 10:10 is an invitation to having life and having it to the full. An invitation to a full and abundant life, an invitation to health and healing and hope. I'm privileged to work with an organisation that has at its mission to share this message of health and hope with its communities. This same organisation has, over the last 25 years, helped to create over 60,000 stories of healing. Who is this organisation? Well, as Sharon has just mentioned, it's the Lifestyle Medicine Institute and its CHIP program, and I'm honoured to be able to share with you some healing stories from CHIP from around the world. Just before I do, though, I'm just going to take a couple of minutes to briefly share the background for the CHIP program for you, since there may be some of you who aren't familiar with it and are wondering, what is the CHIP program and who is behind it? So this will help to make our healing stories more meaningful when we get to them shortly. So CHIP is an acronym for the Complete Health Improvement Program. And the results of the program have been demonstrated since it started to make a significant and a tangible difference in people's lives. CHIP has been a program that has always been at least somewhat associated or affiliated with the Adventist Church. It was developed and owned by an Adventist, Dr. Hans Deal, who is a doctor of health science. It's a 30-day lifestyle intervention program, and it's mostly been run in a local church setting where people from the community as well as church members have been invited along to participate. CHIP has now had, as I mentioned before, about 60,000 people go through the program, and there are about 25 published papers showing the benefits of CHIP as it relates to not just the prevention and the management of disease, but in some instances, even the reversal of disease processes such as heart disease, diabetes, obesity, and depression. So, for example, just last year, the American Journal of Cardiology published a paper showing the results from 5,000 participants from New Zealand, and showed that those who entered the program with the highest levels of risk saw drops in cholesterol, triglycerides, and fasting blood glucose that was equivalent to that of cholesterol lowering or diabetes medication, so very significant. So what is it that makes up this lifestyle intervention? Well, CHIP emphasises a plant-based eating program that focuses on whole plant foods, or foods as grown, and minimises processed and animal foods. While it does have food and nutrition at its core, CHIP also takes a very whole person approach to health by addressing elements such as mental, emotional, social and spiritual, such as forgiveness, our sense of created self-worth, and also social support. Now, of course, as we all know, the origin of the principles that I've just described is not the CHIP program per se. The origin comes from spirit of prophecy and biblical health principles, and it just is packaged in the CHIP framework. So you may be wondering, who is it that actually owns the CHIP program? Who's behind it? First and foremost, I want to particularly acknowledge the founder, Dr. Hans Deal, and to just make mention of the fact that CHIP is where it is today because of his vision and his passion. But the who of CHIP doesn't just stop there. And this is because in June of 2011, the CHIP program was bought by the South Pacific Division of the Church. Now, the Health Food Department of the South Pacific Division, which is actually Sanitarium, was asked to take management oversight of the program on a global basis. And that's where I got to be connected with the CHIP program, and I guess helps to explain why I'm here sharing that with you today. Because what this really means is that CHIP was acquired for the benefit of the local church, but at a local church level. So with this background in mind, I'm delighted to share with you some stories on healing. As I mentioned, there's been 60,000 people through the program, so we actually have 60,000 healing stories, but I'm not going to do that tonight, even though each of them are unique and special. But I have two very special stories to tell and to share with you. The first story comes from the Solomon Islands in the South Pacific Division, where a lady, Carol Boehm, who is the wife of the president of the Trans-Pacific Union Mission, ran just very recently 4 CHIP programs with key influencers and government officials there with a fantastic response. So let's just listen to the story that she shares with us there.
The story of CHIP in the Solomon Islands is really exciting. These beautiful islands are sad that you've been inundated with white man's food, which of course was closely followed by white man's diseases. In fact, the top 5 killers of adults include heart disease, stroke, diabetes, lung disease and cancer. In fact, 6 out of 10 beds in their national referral hospital were taken up by people suffering from diabetes-related illnesses. So something had to be done. So halfway through last year, 2012, we decided to give CHIP a go and see what sort of impact it would have on a developing nation like this one. Our first pilot program, we called it, consisted of 44 people. It was made up of a lot of top-level health professionals, such as the Permanent Secretary for Health, the Under-Secretary for Health, several doctors, many high-level nurses, and other prominent businessmen and women from the community. The results surprised even me. Blood sugars dropped dramatically. In fact, we had several participants join with a blood sugar over 16 and leave with them stabilised around 5.5. Kilos dropped off with an average of about 4 kilos over the 30 days of the program, but up to 10 kilos for a few people. Cholesterol levels dropped and blood pressures came down dramatically. But besides these almost expected outcomes, we had so many beautiful stories of cures. People testified that they slept better than they had for years, that headaches were gone, energy levels were through the roof, arthritis vanished, gout disappeared, asthma, food allergies, and even a peptic ulcer were cured. They were amazed how clear their mind was and the difference it made to their performance at work or under stress. They reported depression lifting and a whole new lease on life. The transformation in these people was nothing short of miraculous. Out of that initial group, several people have trained to be facilitators, and they've gone on and run other programs, in fact 3 since then, with the results of each program being just as fantastic as the one before. In all of this, we haven't done one stitch of advertising. It has all been done by word of mouth, and at the moment, there's a waiting list. Do you believe it? The whole nation is taking notice. So much so that recently, the Prime Minister of the Solomon Islands has said that CHIP is a program that we need, and I quote, to nationalise. I know of no other health tool that has the ability to not only change the health of an individual, but can literally impact a nation. Without a doubt, it's been the most satisfying thing I have ever done. So much so that I can't help doing it again. At the beginning of this year, our family moved from the Solomon Islands to Fiji for my husband's work with the Trans-Pacific Union Mission. And just last night, I ran our very first information night in Suva, and I'm excited to say it was met with a great deal of enthusiasm, support. So it looks like God plans to bless Chip in yet another beautiful Pacific Island nation.
So we'll move to the second story, which is one that I think is really important because it shows that the most important thing is not the CHIP program itself, but the way that we as medical missionaries look to run the CHIP program in our communities through our local churches. And it demonstrates one of the critically vital themes of this conference, which is that it's about the care and the love and the support that we show to people that can touch their hearts and can take them to another level of health and healing by connecting them with the master physician and the ultimate healer. So let's listen to the story of Robert Anderson from Canada, who you will hear first experienced physical healing and then importantly experienced a spiritual healing as well.
Everywhere I went, a shadow of a box 7 feet long and 3 feet wide was following me. With my angina, arthritis, high blood pressure, and extra weight, I knew that it couldn't be too long before I would be in that box. Hopelessness seized him as he drove to his mailbox to pick up his mail 200 feet from his house. Once a proud builder, but now shortness of breath and chest pains, a confirmed invalid. Highly recommended by his physician, 67-year-old Robert Anderson joined the CHIP program. He followed a simple diet of whole foods, he began a progressive walking program, and he left his Marlboro cigarettes, his daily martinis, and caffeine behind. And within weeks, his turnaround began. His angina diminished, his arthritis improved, his weight and blood pressure came down, and his physician had to lower his medications. Now, to celebrate his new freedom, Robert got himself a 21-gear titanium bicycle and began training for the ride of his life. From his hometown in Creston, British Columbia on Canada's west coast to Ottawa, Canada's capital, on the east coast. And then, at the age of 69, the man, once crippled with angina and arthritis, now commenced his ride across Canada on his bike. At the starting line, his physician, who also served as a lay pastor, and with him, his church members. He said, "Robert, there may be moments of charley horses, of pain and discouragement, and you may wonder if you can go on. But we want you to know that we will be rooting and praying for you every day. And to remind you, Robert, here's a small box with 60 love notes from my church members, one for every day of your trip." And then, 60 days later, this man, once crippled with angina, with shortness of breath, and with arthritis, rode into Ottawa as a champion after covering 2,605 miles on his bike. How did he do it? What made the difference? Here's his answer. CHIP teaches 4 basic principles. Number 1, eat simple, whole food, simply prepared. Number 2, burn holes into the soles of your shoes and not into the tires of your car. Exercise and move consistently. Number 3, avoid harmful substances such as tobacco, alcohol, and caffeine. And number 4, develop an attitude of gratitude. After all, God didn't make a nobody. He engineered us for success. Well, Robert Anderson became a new man, a stronger man. Once an invalid, now he got involved in building again, this time the house for his physician. He also became a softer man. He said, "With so much love showered upon me on this trip, all those love notes, how could I forget this? It softened my heart, and I unreservedly turned my life over to God." Robert Anderson was living life to the very fullest again. Just before Robert passed away, some 4 years ago, he turned to his wife and he said, "Just think, CHIP gave us another 20 years, and for me, 18 of these years were good years. I am so grateful." And then he said, "I'll see you in the morning."
It's a pretty amazing story, isn't it? So these stories bring to life the mission for CHIP. One of the key inspirations for our initial interest in the CHIP program was several statements by Ellen White, which encouraged Sanitarium, as part of its health food ministry, to establish in all our cities small plants which will be centres of influence. This, coupled with statements like the medical missionary work should be a part of the work of every church in our land, meant that we became quite excited about the potential of CHIP to be used as a health ministry tool through which medical missionary work can be conducted in our community, and our local church can be equipped as a centre for health and for hope. And while CHIP is only one health ministry tool which a local church can utilise, it is an effective one in terms of health outcomes and the ability to build relationships with people. And so CHIP can become an important part of a comprehensive health ministry approach that helps to equip the local church to be a centre for health and hope. And, as we've said, combined with a loving and supportive relationship approach for the people that come along, can enable the potential telling of many more stories of true healing around the world. Thank you.
Thank you, Kathy. Wasn't that inspirational? You know, it was Foss who said this: "If I can help somebody as I pass along, then my living will not be in vain." And just think of it, 60,000 individuals helped through CHIP. That's amazing. Thank you so much for sharing that with us. We're going to be turning our attention now to our devotional spot, and we'd like to give a very hearty welcome to our devotional speaker, Dr. Bruno Vertallier, who's the president of the Inter-European Division. And with almost 40 years of ministry, we know that he comes to us with a rich heritage in his ministry, in his connectivity with God, and his outreach to the community. And we're going to be blessed to hear from him this evening. But before he speaks, we'd like to welcome to the podium the Londoner Ensemble, and we have 3 musicians who come from the Seventh-day Adventist Church in Prague, and we're going to listen now to the healing sounds of the ensemble, as we have Aneta Kubečkova on violin, we have Jan Kubik on flute, and we have Pavel Blaha on cello. Be inspired, be uplifted, and let the music soothe your heart and soul as we listen to the inspirational sounds of the ensemble.
Thank you. Good evening. It's a pleasure to be together and to be here tonight. Thank you to the musicians. Thank you to those who witnessed concerning health living, and the experiences they have made, sometimes the suffering also. Yes, music, I'm convinced, brings healing. And thank you, dear friends, for this beautiful piece of music. It will certainly bring healing in our hearts tonight. I have entitled my sermon tonight, Full Healing. Do you like, I hope, to be healed? I hope you like to be in full and having a good health. And because the Lord is coming again, we may speak of full healing. Believers want to affirm that a healthy life is needed and possible. Have you ever dreamed? And yes, I have a few questions here. Or if you could only do good because the Lord is good, and heal like Jesus. Would you like to be able to heal like Jesus? If you could only know the Lord in order to do good to your fellow man and heal them. If you could only offer full healing in the name of the Lord to the people around you. If you could always find the right treatment. Wow. What doctors, what medical health professional would you be? People would just be packed in your office because people, they want healing. They want good health, and they're ready to do everything to get good health. And I believe that as health professional, you are signs of what is still good on earth. You represent what people are looking for, and what they are looking for is health. They want good health. Your task is to bring hope to those in need, the not healthy, and there are so many. Today, as in Bible time, the question was, how can I be well again? Where to go? Is there a person that can heal me or improve my health? Or to be healed would be wonderful, but even if I could be better, this would already be good. Yes, people would run the world to be cured. Remember Naaman, the chief commander of the king of Syria. He had leprosy. He wanted to be healed. And you have this very long story and very important stories in the book, the 2 Kings, chapter 5 and on. And this very influential person was ready to pay anything to be back to to health, to be back to living. He brought presents, large presents, and he would really be glad to offer them to the one who would heal him. Yes, I remember a very wealthy person in need of health. I can pay. And this is very frustrating because there are things you cannot pay. And when you are rich, when you have a lot of money, maybe you have the idea you were brought that way and you thought that way, that, well, you can always get anything in this world. But when it comes to health, then, well, the story changes. And that person died with a lot of money, but couldn't recover the health. Yes, remember Bartimaeus. When asked what he wanted, he answered. And you have that answered. Well, beautiful. I mean, very short. Mark 10:51. I want to see. Yes, when you are in need. When you have to live with a disease. When you have to live with a handicap. Well, what a blessing to be able to be cured, to be saved. Health is a major preoccupation for the human beings. So people look at you, doctors, with great hope. How do you feel? What will be the answer? Will you always be able to meet the needs of your patient? I can myself remember that, years ago, a long time, I was desperate. That was in Marseille, in the south of France, like 25 years ago. Well, I was too young to be sick. And by the way, there is no age to be sick. No one will ever say, I have now reached the age to be sick. I mean, nobody wants to be sick. It is never okay to be sick. And I had a terrible backache. I could not stand up. I needed strong medicine to relieve the pain. I went to see a doctor, another one, and one of them directed me to a surgeon. When I left the surgeon, when he told me that I had to go and have surgery, well, he was already sharpening the knives, you know. And I went to look for more advice. I was oriented to a physiotherapist, and maybe he would be the one. And when I entered into his office, I had a shock. Goliath was in the place. I mean, it was a giant. I was tempted to run away, but I could not run. I thought for sure he's going to break my bones for good. A giant. But he didn't. He handled me quite well. He explained what he would do. And also why he would do it in this way. Well, I was lucky I avoided surgery, and that was good for me. He taught me some movements, and even today when I feel that the pain may come again, I do the movement, and then I feel well again. And this has been on and on now for more than 25 years. Yes, when you feel good, when someone has done you good, you are more open to listen to higher concerns, like to be healthy for eternity. Yes, there is a promise that we will also be healthy for eternity. We need to discover when this will happen and how it could happen. I'm sure you will agree with me that it is actually for this reason that Jesus came to earth. That we may feel good and discover his project for eternity, where his people will be healthy. In Matthew 25, Jesus speaks about heaven, about his coming, about full health, how Jesus will bring full health. When you help people to be healthy, they may also be touched by the greater healer. Invite people, yes, and this is my call to you. Invite people to discover Jesus. Help them to discover the one who will introduce them to heaven, to full health. They have to know the one who comes, the one who wants to be spiritually, to make them spiritually healthy, but also mentally and physically. Let us invite people to be alert. Yes, we are counseled to watch. We are counseled to look what is going to come, and of course rejoice about what Jesus will do, as he will bring healing to this planet and to the people that he will also take with him. Yes, please witness to your patients that there is full healing with Jesus. And please do not get sick in trying to know when he comes. Do not bring stress and fear around you when you speak about the one who is going to come and bring full healing. Be healthy and rejoice that he comes according to his promise. Let him bring peace into your hearts. Work for full living, for full health. Yes, Jesus goes on and he explained that he might take some times. Yes, in the second parable, verse 19, chapter 25 of Matthew, he says, yes, after a long time. And again, whether it is long or short, the Lord comes back. And it is important for the people to get ready. It is important for the church. It is important for us all. And I invite you again, doctors and all those working in the medical field, to help people to get ready, to be prepared when the Lord comes and welcome him with joy. And we need to know who is the Lord, who is the one who will bring full healing. And again, we need healing. And when we understand what Jesus meant in that second parable, the parable is quite long, but another key element we find in Luke 19:22. I must know, and this is always very important, I must know the one who is healing. Otherwise I will be judged on my words and not be healed. Yes, you remember what the servant said? You are a severe master. And when we think that God or Jesus is a severe master, we will have a hard time to be healed. How could we say that the one who is only love and grace is severe? And if my words demonstrate that I do not know who is the Lord and who is the one who comes, I will not be part of the joy of the Lord. Because it will tell me that I have not accepted His healing, His forgiveness. The Lord offers me, and He wants to offer me full healing. Yes, Jesus continues and speaks again about His coming and about the coming of the Son of Man. Yes, Jesus is coming. In that parable, He claims that His followers be good in doing good. That His followers will relive the life of the people. And Jesus is quite precise. And when we read again in Matthew 25, verse 35 and on, Jesus explains, yes, I was hungry. You gave me food. You brought to me full healing. I was thirsty. You gave me drink. Jesus brought and invite us to bring full healing to the people around us. I was a stranger. You invited me. Yes, to bring and to offer full healing to the people. I was naked. You clothed me. I was sick. You visited me. Yes, let us continue to welcome, to visit the people who are in need of health. This is what the Lord is asking us. And we could add many other situations. We know you meet with the people in your work, and you know what it means to bring comfort. You know what it means to discover and see how you can bring health to the people. Doing good to people will be an open door to invite those in need to discover the one who comes and offers full healing. Knowing the one who comes will inspire us to act accordingly, to do as if Jesus had done it Himself. Can you imagine that you can be the hand, you can be the arms, you can be the mouth, you can be the words of Jesus when you speak, when you help people for a better living or to cure their disease. Yes, to do as if Jesus had done it Himself. Verily, said Jesus, I say unto you, inasmuch as you have done it unto one of the least of these, my brethren, you have done it unto me. Yes, be Jesus for the people. And as I said at the beginning, you are a sign of what is still good on earth. When you know the Master, you will act as if it was the Master acting among us, in our midst, and encourage many others to do the same. Yes, dear professionals, I want to thank you for your engagement, for your service in the church, for your engagement in the community. You are touching the misery of the society every day. Continue to be sensitive like the Master who comes. Be open doors and invite people to discover the Master who wants to save them and deliver them from all diseases. Yes, continue to offer full healing to the people around you. In doing like Jesus, you will demonstrate that you have been fully healed yourself by the divine Master, so that we may all enter in the joy of the Lord. I believe that this is God's purpose. You remember what the servant of the Lord has written. Yes, our Sister White wrote that Jesus mingled with people, that Jesus desired the good of people. He met their needs and invited them to follow him. We only want full healing from Jesus. So tell it and show it to all the world. May the Lord bless you, and that he may continue to act in our hearts and in our lives as he has done in the past and as he has done until he comes. Amen.